Okay, thank you very much. Thank you for the opportunity to present this work. These are my disclosures. And we know that there's no clear consensus on definition of frailty, but there's it influences individuals' physiological state, and we've got some patients that are more vulnerable and prone to dependency with a reduced life expectancy and increased demand on medical and social care with increased economic costs. We wanted to know factors related to the presence of the urinary tract infections in this population and to propose improved measures in the management of recurrent urinary tract infections, avoiding antimicrobial prophylaxis. We designed this multicentric perspective study in institutionalized people diagnosed with these recurrent urinary tract infections, and patients were given continuous low-dose antibiotic prophylaxis in Group A and immunoprophylaxis treatment with a polybacterial vaccine called Urinary. These vaccines favors immunoactive prophylaxis using a suspension of 4 different strains of four different bacteria. Is E. coli, Klebsiella pneumonia, Proteus mirabilis, and Enterococcus fecalis. And we hypothesize that stimulating one mucous membrane produces an effect in another distant mucous membrane due to the activation of acquired and innate immunity. With this vaccine, we are supposed to give a pathogen that is stimulating the toll-like receptors, and this leads to the initiation of different pathways with the liberation of pro-inflammatory cytokines and other interferons. We didn't find any difference on average age between women and men in the whole sample, and there were more women than men included in the study with a similar distribution in both groups, the group given the antibiotics and the vaccine. The mean number of urinary tract infections per year before the prophylactic treatment was 8. We didn't find any difference in the clinical manifestation of these infections in patients, and we can see that the most symptoms shown were nervousness, dysuria, confusion, and hematuria, since elderly patients don't show the usual symptoms as in younger patients. Patients were undergone a convert test, and it was positive in the most patients. Only 10% of patients didn't get a convert test. And there was quite a relationship between the positive convert and positive urine cultures, but there was a 24% of false positive convert tests. But we can see that if we had a negative convert, it was correlated with a negative urine culture. Focusing on UTI episodes, we see that we've got more episodes with the within patients getting the prophylactic treatment with continuous antibiotics, and patients had a better sensation of improvement measured with a visual analog scale when using the prophylactic vaccine. Also, we wanted to study if there was a difference in this sensation of improvement in those patients, and we saw regarding the secondary diagnosis the patients had, and we saw that severe urinary incontinence was associated with a poorer improvement in these patients. We wanted to focus that in urology, these antimicrobial stewardship programs should include a series of measures to ensure the rational and evidence-based use of antimicrobials in the prevention and treatment of infections, but also we have to follow the guidelines of finding other non-antimicrobiological prophylaxis. And in our study, we saw that the polyvalent bacterial vaccine is effective in the reduction of UTI against continuous low-dose antibiotic prophylaxis in frail institutionalized older adults and provides improvement in the quality of life. Severe urinary incontinence that requires the use of absorbents for a greater degree worsens the management of UTIs in the frail institutionalized elderly. Thank you.
Okay, paper is open for questions.
Hello, Melissa Davis from the UK. What was the mean reduction in number of urinary tract infections in this group? Because I didn't see a number. I saw that they were having 5.8 before they started with the Urimune vaccine. And how many were they getting after?
They had 8 before, and then they had less than 1 in the whole sample. Less than 1 in this year.
And how was that? Was that just on dipstick, or was that microscopy and culture confirmed?
Yes, they had. So the results that were shown in the...
So the question, I think it's an important question. What is the definition of a urinary tract infection for the purposes of this study? Because it's hard to make that diagnosis in the frail elderly.
That's it. So we've shown... well, I've got here another slide now. But we showed that in these frail elderly patients, we didn't get only the classical symptoms of dysuria or frequency, but also if patients had a difference in their general status, the way that nervousness or even hematuria are not given for a bladder cancer. So they had symptoms, or these quite of uncommon symptoms, and the positive culture.
So symptoms plus a positive culture.
Yeah.
Okay, thank you.
Or the camber, but we saw that there was only 10% of patients that didn't get a camber test, but they nearly all had the urine culture.
Did you look at any immune markers to see if the response to the vaccination actually correlated with the clinical improvement?
Not in this study.
Okay, thank you very much. We need to move on to the next paper. Appreciate that.